Hey everyone, imagine you're sick. You've got the cold, you've got a fever, your body's shaking. What do you do? I don't know about where you live, but in New Zealand, it's very hard to get into your medical doctors. But nevertheless, you strive, you try your best to get in to see the doctor. And guess what? You're not ashamed of it. Oftentimes, you talk about the frustration you have on the time it takes to get to see your GP. But imagine this. You are depressed. Medical professionals and clinical psychologists, which I'm not, I'm a applied clinical sociologist. But if you talk to a medical professional or a clinical psychologist, they would tell you that depression is much more than just a normal feeling of sadness that we all have. Human emotions are normal and natural to have, but depression deep in your core or a mental health, any other form of mental health strife, that you're either really excitable or really depressed, and that you just can't shake it, although people are asking you to. You know there's something wrong with you, but you're feeling afraid. You're feeling shy. You're feeling embarrassed. I'm here to tell you there is nothing to be ashamed of if you have an episode or a mental health episode. There's no different than having a fever. So I encourage you to go and see a specialist. If you don't want to see a medical specialist or a psychologist in the first instance, speak to your pastor or come to a counselor or a supervisor like me who can then guide you and work alongside you as you approach a mental health specialist, if if that's necessary. For far now, for people, for family members, for loved ones looking on, don't feel scared or don't feel hopeless when you feel your loved ones are going through a mental health episode. And don't cover it up because you're afraid that someone will judge your loved ones. Now, in my house, we've got the CPR posters everywhere because my family is quite passionate about following paramedic care in St. John. So we've got something called the Doctor's ABCD, which is the first aid for CPR and how the steps you go through when you feel someone is in physical distress. But I'm here to tell you, you can use the Doctor's ABCD when you encounter or when you see somebody encounter a mental health episode as well. So Doctor's ABCD, D in the mental health context stands for danger. Ensure your environment is safe both for you and for the person in distress. Look for any immediate risks such as self-harm, substance abuse, or an unsafe location. R, response. Check if the person is responsive. Are they able to communicate? Or are they withdrawn? Are they agitated? Are they showing signs of extreme distress? Use a calm and supportive approach. I've noticed people saying, "What's up with you? Just take it off." That doesn't work. Use a calm approach. Or don't go outside the room. I was in a health organization, an allied health organization. This people went outside and they were fighting and they were saying, "Oh, she's such a loser. She doesn't know what she's talking about. She's cray cray." Don't do that. They might hear you. Be kind, gentle, and do not judge. As doctors, send for help. If the person is at risk of harming themselves or others, you must immediately seek professional assistance and help. In New Zealand, emergency services can be contacted by calling 111 or reach out to a crisis helpline. In New Zealand, it's 1737. Now look around in your country what those emergency numbers are and then contact a trusted support person. And then A, doctors ABCD. A is for airway. So like in CPR, we talk about clearing a person's airway. So if the in a mental health context, this refers to ensuring open communications. Are you able to communicate with this person? Encourage the person to talk if they feel safe to do so and if they are able to do so. If they are non-responsive or unable to respond, whether because they are agitated or they've got an overdose, they're unconscious or they're in distress, um, you must follow the physical airway checks that you would do in a normal CPR. B stands for breathing. Encourage slow, deep breathing to help the person that's in distress regulate their distress. It sounds really simple, but slow, deep breathing is cures many ailments. So you must speak in a calm voice as well and encourage them to regulate their breathing. Hyperventilation is common in distress and panic attacks. It's important that you, as the person that's looking after them, is able to guide them through breathing techniques that can be very helpful for them. Doctors ABC. C stands for circulation. This relates to in a physical ailment, you look and see if they're breathing, if their circulation's okay. You need to and then you'll commence your CPR. But here, commencing CPR emotionally means stabilizing the person emotionally, help them stay present by using grounding techniques, gentle reassurance, and checking for physical signs of distress. So, for example, this could be rapid heartbeat, sweating, agitation. Just notice that and then work with them to calm them down. D is defibrillation. In the mental health context, it is the decision to act. In a mental health crisis, this means taking actions, whether that's calling for professional help, and I've given you the numbers before, or staying with that person until support arrives, or assisting them with the necessary ongoing care. Now, I've given you this example of this allied health supposed professional. They were mocking, I was there, I was trying to calm the person down. They were mocking me and they were saying she's just cray cray. That is not what you do. You act decisively, but you act in a calm manner. You be professional about it. Know when you're able to help and know when it's beyond you, and know that you need to seek other assistance for the person. But in all means, remember this is a human being deserving of your respect, and speak in a tone of voice that is calming. Now, you don't want to lie to them. You don't want to say if they're hearing voices, you don't, yeah, I hear it too. You say, things like, look, I can't hear it. I appreciate it's very distressing for you, but I'm here to help. Treat them with respect and do not be afraid to call for help, and do not be afraid or ashamed, because there is no shame, just as there's no shame if you had cancer or a cardiac arrest. There is no shame in seeking help when one is in mental health distress. And equally, if you're the person helping them, it's important you treat that person with respect. This is Dr. Jessica, your sociologist, encouraging you to seek help or be of help, help that is given with dignity and respect. Until next time.